everyone. Today's lecture is on Chapter 1, Frameworks for Guiding Practice from the Nelson textbook. There are three main points for this chapter. The first one is the importance of asking good questions. The second one is contextualized assessment and intervention. And the third is the World Health Organization definitions. On page 22, there's a chapter summary and study questions. I encourage you after the chapter lecture video to look over page 22 and read the chapter summary and look at the study questions as they will help you prep for the upcoming exam. On the second slide here, you'll see the learning objectives for the lesson. So how long has evidence-based medicine been around? So the historical roots are from the post-revolutionary Paris time, and also we see them in ancient Chinese medicine. So when we talk about asking good questions, we want to use evidence-based practices. So I encourage you to use the textbook to approach your reading with questions in mind that will help you construct deeper meaning. Also, we want to use the processes of analyzing, synthesizing, and evaluating processes, and those are all on the higher end of Bloom's taxonomy. So within this process, we have the ASCAE 5-step approach to evidence-based practices. So this is a mnemonic to store the 5-step process for conducting EBP in your long-term memory. So for this slide, what we want you to understand is to teach you the process for conducting evidence-based practices. So you will not learn all the answers, but you will acquire tools for continuing to learn, including background questions about the nature of language and literacy disorders and related conditions, and also foreground questions, the PICO questions, for designing interventions for a particular child. So I'm going to skip the next two slides and go to the EBP triad. So there's three legs of the EBP triad. The first one is best research evidence, clinical expertise, and client values, abilities, and needs. So I want to ask you a discussion question, which is, are there any essential components that are missing from the triad? Which do you view as most critical? Which do you think is the easiest to identify? And which one is most subject to bias? Okay, so when we look at this slide, there are some background questions about the general knowledge about a disorder, and there's two essential components. The question root, so those are the basic who, what, where, how, and why, and a disorder or aspect of the disorder. So those foreground questions, the PICO, they ask for specific knowledge about managing patients with a disorder, and they have 4 or 3 essential components. So when we look at well-built foreground questions, it is involving the patient or the problem of interest. The main intervention is the diagnostic test, the prognostic factor, the treatment, or the patient perception. There's also comparison interventions and clinical outcomes of interest. So when we look at formulating a PICO question, this is taken specifically from the text. So it's the person, population, problem, or perspective, the actual intervention, comparison or contrast, and then looking at the outcomes. So this is the evidence pyramid, and it is from the highest evidence to the lowest evidence. So you can look for specific indicators from research articles to pinpoint the research design's strengths and flaws. Okay, so I'm going to skip to the slide on collaborative consultation. So what you should be able to do is differentiate between expert models of consultation, so for example, one-way communication, from collaborative models of consultation, so for example, starting with a blank slate. So when we look at the cooperative goal setting, we have competitive goal setting, individualistic goal setting, and cooperative goal setting. So what I want you to do is identify examples of each of the three types of goal setting and group problem setting. And with that, you should be able to indicate which would be most likely to be used by a multidisciplinary team and by an interdisciplinary team. So when thinking about that, for a multidisciplinary team, you would use competitive or individualistic, so number 1 and number 2, whereas for an interdisciplinary team, you would use cooperative goal setting. So this brings me to main point 2, which surrounds curriculum and context-based language assessment and intervention. So curriculum-based assessment assesses student performance within course content to determine a student's instructional needs. And you ask yourself, is the child learning the social studies curriculum? So that is an example. Curriculum-based language assessment and intervention. So here's a direct quote: the use of curriculum context and content for measuring a student's language intervention needs and progress. So asking yourself, does the student have the language skills to learn the curriculum? Because students need the language component to be able to understand what the teacher is teaching them. So we ask ourselves, what context? So we can look at this slide on maintaining balanced focus on client needs. Remember, our client is the student in our future classroom. So we're focusing on one small aspect of a particular language problem. We want to think about possible immediate causes and effects of the problem and their implications, and shift to a medium level of focus, perhaps thinking about other aspects of the problem and effects within a particular family or a classroom context. So we want to think about ethnography. What ethnography is its systematic study of people and cultures. So once again, that's a systematic study of people and cultures. And when you're studying in that way, you can do this through interviewing, observation, studying artifacts, and interpreting multiple sources of data. So those multiple sources of data for the interviewing can come from student, teacher, and parent interviews. Okay, so I'm going to skip a few slides, and I'm going to skip to this slide. So right here we have a quote: the goal in interviewing is to have participants talk about things of interest to them and to cover matters of importance to you in a way that allows participants to use their own concepts and terms. Okay, so when we think about that, list and labels about strengths and needs. So we can ask, what's the best thing about school? What's the hardest and the worst thing? Those are 2 interviewing questions. Okay, then we can talk about specific events. So when was the last time you felt bored? And the example of that question and answer would be when the teacher explained the math lesson and I didn't know what to do. So the difference there is that is more specific in the question that we're asking. So here are 4 questions involving assessment and intervention. So for the assessment, what does this curricular context require, and what does the student currently do? When we look at the intervention piece, what might the student learn to do differently, and how should the task be modified or scaffolded? So main point 3 is on the World Health Organization. So here we have 2 conceptual models of disability. We have the medical model and the social model. So the difference being the medical model is a disability is a feature of the person. It's directly caused by disease, trauma, or other health condition. It requires medical care in form of individual treatment by professional to correct the problem. For the social model, we have a socially created problem, not an attribute of an individual. It's created by unaccommodating physical and attitudinal environment and demands a political response. Here's a quote directly from the text. On their own, neither model is adequate, although both are partially valid. Disability is always an interaction between features of the person and features of the overall context in which the person lives. But some aspects of the disability are almost entirely internal to the person, while other aspects are almost entirely external. So the changes in the latest version is disability and functioning are viewed as outcomes of interactions between health conditions and contextual factors, including environmental factors and personal factors. The International Classification of Functioning, Disability, and Health, it's a system for classifying health and health-related domains, the body structure and function, activity and participation, both being elements of that. So the view on disability is it's an impairment, a problem in the body's structure or the body's function. Activity limitations, so difficulties in executing activities, and participation restrictions, so problems in life situations. So here we have the three categories of this structure: body, activities and participation, and environmental or contextual factors. So the impairment assessment model, we look at the communication processes model that relates to WHO levels of the three assessment models. So we want to recognize and categorize examples of clinical activities that are questions about communication processes, needs, and opportunities. So this slide in particular covers that first category, which is communication processes. So what is wrong and right within the individual. So with that, we look at the impairment, which is the problems in body function or structure, such as significant deviation or loss. So the second category is the communication needs model. So the activity limitation is difficulties an individual may have in executing activities. So we're asking ourselves, what does the individual need to do to function in important life contexts? The last category is the communication opportunities or participation model. Participation restriction, problems an individual may have in involvement in life situations when we're asking ourselves, what opportunities does this individual have to participate? So remember, page 22 is the chapter summary and study questions. If you have any questions at all, please post them to the question and answer forum on Moodle. Thank you.